I start with you?
Sure, yeah. I'm a rehab medicine physician from Halifax, Nova Scotia, Canada, involved with the wheelchair skills program and ISWP for a number of years, and really looking forward to your talk. No experience with the Dominican Republic directly.
Awesome, thank you, Lee. How about you, Karine?
Hi, I'm Karine from Novokuznetsk. I'm looking forward to the presentation because this topic is very interesting for us. We'd like to make some notes. So
thank you so much.
Yes, are overcome.
Wonderful, thank you. Yeah, we look forward to brainstorming with you. Sudhakar?
Sudhakar, if you're speaking, just want to let you know your microphone's muted.
Sorry, some network issues. Yeah, I'm just back now. Hello all. Can you hear me?
Yes, we can hear you. And we know you're from Motivation India. Thank you so much, Sudhakar, and welcome. And how about you, Akutevi?
Hello, good morning, everyone. Yeah.
Good morning.
I'm PNO. I'm now doing research in Japan. It's 12 a.m. here, Thursday. And I'm very interested. Now I'm taking the wheelchair course with International Society of Wheelchair Professionals. So I would like to learn more about wheelchair. That's why I joined this meeting. Thank you.
Thank you so much. Welcome. And Dana, I believe you're connected now to audio?
Yes, I am.
Welcome.
Thank you.
And where are you from?
I live in Southern California, the U.S. I don't like to say I'm from here because I haven't, but this is where I currently live.
Okay, excellent. Thank you for joining us. And how about you, Ali? Ali, if you are speaking, you are on mute. And please feel free to just chat. Oh, I see you've come off mute.
Yes, hello, how are you?
Good, thank you for joining us. Where are you coming from?
I'm from Yemen. I am a wheelchair technician.
Wonderful, welcome. And Sarah and Nancy both represent the ISWP team. Sarah is from Colombia. Nancy is from Pittsburgh, Pennsylvania in the US. And how about Rosie?
Hello, everyone. I'm logging in from Ireland.
Wonderful, Rosie. Thank you for coming.
From the University of Limerick, and I'm an occupational therapist.
Excellent. Mary Goldberg. I am a kind of sitting co-director for ISWP as we spin out to a separate entity. I'm also an associate professor at the University of Pittsburgh in the Department of Rehabilitation Science and Technology. And my first work experience in the Dominican Republic was fortunately with Alba through a connection of our colleague Maria Toro, who really was foundational in forming our practices there, our programming, and a wonderful technical advisor. So she moved on to another role, but we are still very much crediting her assistance and support in developing the presentation. And I'm happy to turn it over to you, Alba. Thank you.
Thank you. I'm really glad to be here. Can you hear me properly? Yeah? Yes, thank you. My name is Alba Polanco. I'm from Dominican Republic, as Mary said, and I'm really happy to share with you what we have been working recently with ISWP in my country. And I work with public policies regarding gender and disability inclusion, and that includes the last few years, the developing or designing or making the first steps towards wheelchair service provision system. So today we are going to share with you what this work has been, and first of all, what was the situation before this agreement with ISWP and this help. And our objectives today will be that you will be able to describe 3 major recent positive policy changes in the Dominican Republic wheelchair sector, relate the DR wheelchair sector current opportunities with those in your context, and identify one area for potential rapid and sustainable wheelchair sector development in the DR. So we will appreciate all your feedback and your ideas, and any way you can relate your experience with the Dominican Republic. We think this will help us grow, as well as our experience could help your country development of the system. So first of all, some background for you. I don't know if you know Dominican Republic. Do you? Yes, Nancy does, and Kritika. Well, we are located in the Caribbean, and we share an island with Haiti. So this red here is Dominican Republic. We are surrounded by water. And besides that, we have beautiful beaches. This is really important for the wheelchair sector, because we do have a lot of issues regarding materials of wheelchairs for the salt and the proximity to the sea. And we have, from the census, the 2010 census, 10.7 million people living in the Dominican Republic, and 12% of them lives with a disability. And it is estimated that more than 400,000 people have a mobility impairment. We are going to do the next census this year in 2022. It was programmed on 2020, and you all know what happened in 2020. And it's going to be this year. And fortunately, we are going to have better data regarding disability, because we adopted the Washington Group statistic data set, and that will improve our information regarding disability. Dominican Republic has ratified 2 important conventions. One was the Inter-American Convention for the discrimination of people with disability, and the CRPD, the Convention of Rights of Persons with Disability, on 2009. We do have a strong background regarding the legal framework. Besides this convention, we also have Law 513 that ensures access to assistive technology, and is based on CPRD and makes the government responsible for the provision. So throughout this session, we will discuss some issues or some situations that limits the implementation of this law. So, but it's good to know that we do have a legal framework that supports all of this, and that's a really first step in order to ensure assistive technology provision. So, just a second, okay. So regarding governance, there are 2 government agencies involved in service provision of wheelchairs. And one is the National Disability Council. That's where I worked when we worked with ISWP. And this National Disability Council leads and oversees public policies are inclusive of persons with disabilities. By law, CONADIS is responsible for final approval of individual AT needs. One of the limitations of CONADIS is that it only has office in Santo Domingo, our capital city. So in order to get access to the whole country, we will need to work within the health system. That the responsible of that is the Ministry of Health, and that also work with the rehabilitation services. It has nationwide coverage, but public rehabilitation services are really scarce, since there is not an integrated system. There is no guarantee of continuity of health services. So we do have public rehabilitation services, but they are really limited, and most of rehabilitation services are provided by an NGO called ADR, in Spanish, Asociación Dominicana de Rehabilitación, so we call it ADR. And this is the NGO that provides most of the rehabilitation service in the country. So historically, now we're talking about products and services. the Dominican Republic has relied on the donation of imported wheelchairs for, to get the provision, right? So they are either donated by international organizations or they are bought from local vendors to donate to the user. The most common wheelchair provided are standard, active, which is parallel to US light wheelchair, and all-terrain models. Most of them are donated by LDS, the Church of Jesus Christ of Latter-day Saints, is the major provider of wheelchair in the country, but we also have a local manufacturer chair. It's an all-terrain model. I will show you a picture in the next slide. This locally manufactured chair costs approximately $430, and it's, as I said, an all-terrain model, which is really common in low and middle income settings as daily use chairs for rough and inaccessible environments. This chair is frequently donated through donor partnerships. So people with disability or with mobility impairments on need of a wheelchair will get it as a donation. We do have some international organizations that come to the country 1 week per year or sometimes 2 weeks, and they are the major providers of special wheelchairs for postural support needs. And as you may imagine, it's a little complicated regarding the capacity of these international organizations to provide coverage to all needs of special wheelchairs. First of all, because coverage is not sufficient through these protocols, as you may imagine, we as a country need to provide these special wheelchairs as well, these postural support needs. And also because when professionals comes to a country and then go, if you don't work on national capacity, the follow-up and this step, on the who steps will be lost and will be lost. And some of them do provide like training when they come in on this week, but it's not that not always happen. However, these organizations have shown some interest in articulating with government to improve the system, so we have an opportunity there. Guidelines, standards, or minimum requires either for products or service, local provision, or international donations are yet to be developed. So we have a lot of opportunities. And as you may see, historically, we have had wheelchair service provision through donation, and that implies that it's not a right. And it continues the vision that it's like charity, and that's supposed a problem, right? To guarantee the appropriate wheelchair. Something that is really good is that wheelchairs are exempt from importation taxes for NGOs, people with disabilities, and companies led by people with disabilities. This is by law. And as mentioned before, you can also get a wheelchair out of pocket in a vendor. Outside these options, before the end of 2019, that was when we began working with ISWP, a wheelchair could also be obtained through a traffic accident fund and labor risk-related insurance, which is different from the health insurance we will discuss later. And within these options, you have 100% coverage. I mean, if you have a traffic accident and because of that traffic accident, you need a wheelchair, the government will cover you 100%. And also if you have an accident related to your job, a labor risk related insurance. Sorry, 1 second. So sorry. So in that case, you will also have a 100% coverage. What we didn't have before 2019, it was coverage within the health system and within the health insurance. And that happened right there, and I'm going to explain that later on. This is an example of an all-terrain model. This is the one that is locally manufactured by ADR. So you can have a picture here. And about personnel, we have also some opportunities here and some limitations that I'm going to share want to share with you. In the Dominican Republic, the whole country, think that we have more than 10 million people and at least 1 million that has a disability, and approximately 400,000 that need a wheelchair or has a mobility impairment. Okay, so we have less than 100 professionals involved in service provision that have received a basic training on wheelchair service provision, and less than 20 that have received an intermediate training as defined by the World Health Organization. However, we have this, right? But the wheelchair provision personal guidelines are lacking, and most of the people trained are located in Santo Domingo, again, the capital city. So we are missing like a territorial framework here. So since 2016, Mary, if you can help me with the time, I will be
You're doing well, thank you.
Okay, thank you. So a little bit more about provision and user training. Since 2016, we have had peer-led independent living workshops that have been implemented by CONADIS to promote independence and train on wheelchair skills to people that use wheelchair, right? Although these workshops are not directly related to the wheelchair provision process, participants may be able to obtain a new wheelchair through this mechanism. The good thing about these workshops is that they are a week long, and a lot of people that comes to this workshop, they have never go outside their houses because we still have a lot of stigma regarding disability, and you don't see a lot of people on the streets with disability. And also because we do have a lot of issues regarding accessibility, about citizen security, and some issues that we share with most part of Latin America. However, within this workshop, you are able to share with other peers and learn from them and teach them, and also learn how to use your wheelchair properly and how to maintenance, do some maintenance to your wheelchair. So that really helped thousands of people with disability. In 2019, we held 2 versions of these workshops, but for rehabilitation professionals, including physicians, nurses, OT, and PT, and more than 80 professionals were trained. Throughout a week, they learn abilities to use the wheelchair, they learn how to prevent ulcers, they learn also about postural support and interventions to promote independence. And that was like a whole process to strengthen the university protocols that we have, because one thing that I think is really important for you as an academic partner of ISWP as well is that we only have 2 universities that have a rehabilitation school, and wheelchair training is only included as part of 1 course in the whole career. And so it's really limited what a professional know when they finish their grade, right? Their career, right? It's really limited what they know about wheelchairs. So we did this from CONADIS and with the universities to strengthen the capacity that they had to provide appropriate wheelchair services, and also to understand the importance of independence and autonomy on people with disability. Because something that was really common is this medical framework of disability in general, not only regarding wheelchair, but this idea that the professional is the one that knows everything, and it was not person-centered. So this workshop also helped with this. So let me go to the next slide. These are some pictures of these independent living workshops for rehabilitation professionals. We had help here from Mexico, from Vida Independiente, like it's organization in Mexico that helps with this kind of workshops. And now I'm going to share with you these recent policies that we have since 2019 and when we began working with ISWP. So what happened on October 2019? The National Social Security Council approved the inclusion of manual wheelchairs, pressure relief cushions, and special strollers for people, pay attention here, with permanent disability as certified by CONADIS in all health insurance schemes. So let me explain this like in more detail. In Dominican Republic, a permanent disability, it's considered when you have a long-term condition that, and when you apply the WHODAS, which is the World Health Organization Disability Scale, you get more than 5, which is really low. And CONADIS is the only institution that is like legally approved to consider a person with permanent disability. So first of all, to get a wheelchair through the health insurance, you will need to have a permanent disability. So if you just have some accident that is not work related or not traffic related, you wouldn't get any kind of wheelchair coverage with this. Also, when we talk about 2 different health insurance schemes, we're talking about contributive and subsidized. Contributive is for people that have formal jobs, and which is really scarce within disability population. And subsidized is for non-formally occupied or inactive people and low-income citizens. Important to notice that in the contributive scheme, not only for wheelchairs, but for everything you need to buy through the health insurance, you need to make a co-payment of 20%. And the funding cap for the coverage of the wheelchair was $430. If you remember correctly, this is exactly the cost exactly of the locally manufactured wheelchair that we have here. So pretty much this coverage this funding cap is only enough to buy the locally manufactured wheelchair. And this supposed limitation for a lot of people with disability. So even if we think that this is a great step, because it changes the mentality that this is charity, it includes wheelchair within the health insurance, which is great. We still know that there are several limitations and that we still have a lot to grow, right? And next, okay, I already said about the funding cap. Also, I need to mention that special strollers are included, but they are only approved for children with a cerebral palsy diagnosis. And wheelchairs may be changed every 5 years or before, only if authorized by CONADIS. So what we did first was to define the products that were included in the resolution, because it only mentioned wheelchairs by name, but it didn't have any definition that helped all the partners to understand the same and to be on the same floor, right? It says active, it says sport chairs are also included, special wheelchairs. So what we did was to create definitions for standard, active, all-terrain, sport, special wheelchairs, and strollers, to make sure that health insurance and vendors knew exactly what we were talking about when CONADIS approved one chair for a person that was looking for. Because remember that by law, CONADIS is the responsible to approve, for the final approval of any individual 18 needs. Later, we held stakeholders workshops, and we work with all insurance companies. We have 22 in the country and 12 vendors, and we train more than 50 people regarding the importance of the appropriate wheelchair. Because I don't know in your countries, but here it's really common that insurance company just do as they want. And we needed something to make sure that they knew that also for them, it was important to have approved the appropriate wheelchair, because it costs money as well, and it costs money for them as well. And it's important for the economy, it's important for health, And because if you don't have, as you know, the appropriate wheelchair, it will mean probably other health issues for the person with disability. So we make sure that insurance company understood that, and also vendors, and what we did was create some some standard operating procedures regarding like the waiting time, the vendor selection. We also use some guidelines for procurement and advice for international experts and local experience to define the products, so to guarantee proper provision. And so last, we made an agreement with CISAREAL, which is the Superintendents of Health, to, that CONADIS would develop a mandatory certification process for vendors' personnel to guarantee proper fit to user. Because as Mary will explain, the fitting will be done on in the vendor location. However, this step is yet to be developed. CONADIS haven't yet developed this certification process, but we are hoping that we do that really soon, because it will be a way to guarantee that we have like appropriate personnel feeding the shares when they get it on the vendor. So now, Mary, I'll pass the.
Thank you, Alba. If you could please advance to the next slide. Sure. Thank you. So this graphic demonstrates the ways that an individual can access a wheelchair with this new policy. They can either go to their insurance company directly, and then the insurance company will inform CONADIS to set a date for the assessment, and that includes both the certification and the wheelchair, and then go directly to CONADIS with their documentation, and then CONADIS would set the date and conduct the process and let the insurance know the specifications and their approval. So the assessment occurs at that level there at CONADIS. The vendor is the one that is responsible for the wheelchair delivery, and therefore the steps of procurement and product and preparation and fitting and user training. And we know that this is currently problematic because the whole training process and capacity really is not yet systematic. You can go to the next slide, please, Alba. To date, users were informed about this new process through newspaper press releases and stakeholder web pages such as CONADIS and the National Social Security Council. And you can see an image of the ad there. This is from November of 2019. We can go on to the next slide. Thank you. So this demonstrates how ISWP has been able to help build the capacity of the service providers in the Dominican Republic. We were fortunate to receive funding from the Pan American Health Organization, and the participants were selected by CONADIS, and they looked at geographic distribution of participants when selecting them, as well as their involvement in wheelchair service provision. We included community leaders, stakeholder representatives, rehab professionals, and academics. The program had 3 different phases. The first was a hybrid in the basic level of wheelchair service provision, and we had 39 out of 40 participants finish. We then encouraged them to complete the ISWP certification at the basic level. And then the next step was to train them in a training of trainers course. This was also hybrid, and we had 10 out of 12 participants finish that. And so the goal after this is to facilitate intermediate trainings, and we would have the trainers engage and help to support those trainings. You can go on to the next slide. Because we were doing this in the midst of the pandemic, we got really creative. That video there shows an individual performing wheelchair skills, and our own Sarah Muniera, who happens to be in the call, is her little thumbnail image is in the upper left-hand corner of that video. So she is providing live feedback from Colombia. Maria Toro is actually the one that took the picture of this video from her desk in Spain. So we're working across multiple time zones. We had live facilitators there in the Dominican Republic who were helping to set up the exercises and provide some feedback and training, but it was really these remote instructors that were pitching in through Zoom who really led the charge and were still able to provide feedback via the live feed. So it's an interesting case example. And Krithika, our colleague who many of you know, published a little case study on this through the UN. So congratulations to her. And it's wonderful that we've been able to share what we did there in that way. And we can go on to the next slide. So related to the products, the DR now is in the process of getting the ISO 7176. So this is the International Standards Organization, trying to get this standard as a national norm. So ISO 7176 dictates the requirements and test methods for static, impact, and fatigue strengths. So far, this has been reviewed by an intersectoral committee, and now it has been put out for public comment. And after this process, it will get checked by the Dominican Quality Council, and they'll approve it, and then it becomes a national norm. You can go on to the updates. So like many of us in many of our activities, we've experienced some roadblocks along the way. We hope that these are just some challenges and that there will be continued momentum forward, but due to the pandemic and getting slowed down, and then in the midst of that, a national election with the leadership change resulted in limited implementation, such that only one wheelchair so far has been delivered according to the process. We are hopeful about ISO Part 8 of ISO 7176 being adopted soon, but unfortunately the capacity building has stopped at this juncture as well. We can move on to the next slide. Thank you. So at this point, we'd like to turn it back to you. We want this session to be interactive, but we're interested in understanding how the context in the Dominican Republic relates to yours in terms of provision, products, or policy. So just take a few minutes and jot down some specific examples relating to provision, products, and/or policy. This is just an individual exercise for now. Alba, if you wouldn't mind going on to the next one, please feel free to continue to reflect. But if you have anything that you're interested in sharing, we'd love to hear from you. And you could either start writing this in the chat or just speak aloud.
I'm happy to make a comment. I've enjoyed listening to the presentation and all that's been accomplished at the policy level and right down to the individual level. Very impressive. My interest is in wheelchair skills training as step number 7 in the WHO steps of wheelchair service provision. And I was interested to see the remote training, the combination of remote training that's gone on, and the COVID has sort of forced us here in the wheelchair skills program to do more remote hybrid training, online, the combination of self-study plus getting together by Zoom. And it's I guess it's a silver lining from the pandemic in that our ability to provide such training has increased, and there have been a couple of recent published papers on remote wheelchair skills training that have shown that it can be effective. So I'm very pleased to see that. And maybe since the capacity building has had to come to a stop in the DR as far as bringing people in, that you can access knowledge experts remotely for some of that training in the future.
Thank you, Lee. I see that Sarah has noted that the legislation is more advanced in the Dominican Republic than in her country, Colombia, but they're getting there, and that DR is a great example. Thank you, Sarah. All right, in an interest of time, let's go ahead and move on, and perhaps you can keep the comments coming in through the chat. So thanks very much. Related to future work, we're encouraged by the Advocacy. So this is a WHO effort that in the Dominican Republic has been operationalized by PAHO, which will provide a high-level picture of the capacity that the country has to regulate, finance, procure, and provide assistive technology. It's not yet public, but we anticipate that much of what we're trying to push forward in terms of advocacy and awareness is going to come out that there is a need for more trained service providers, and perhaps resources will follow that. There's also a new care policies pilot that's coming out that mandates or suggests that care is a right for all, with a specific emphasis on both the pediatric and the elderly population. Excuse me, and provision of assistive technology was included as a part of that pilot. So that's also very encouraging. This last one is still at the conceptual level, but there is a university-centered service lab that has been proposed, which would provide direct skills practice to rehabilitation students, but it would also ensure user training for consumers. So a nice kind of public-private partnership there with one of the main universities that provides rehabilitation education in the Dominican Republic. And we could go on to the next one, please. Thank you. And so related to future work, we've broken this down into a few different categories. The first one being provision, product, and policies. Is the availability of technical support to develop and implement product and service standards, as well as the overall design of the infrastructure that would ensure proper procurement, follow-up, and maintenance of the product. So we've already talked about the inclusion of wheelchair provision in the disability certification system, but also development of an information system. You can go on to the next one, please. Also, advocacy for people with disabilities, we know, is key. So continuing to promote this through stakeholder meetings and other activities that might continue to empower users to have an awareness of what their rights are and of how the wheelchair service provision process works in the Dominican Republic now. We also promote additional partnerships that can facilitate access to users who cannot afford this co-payment or need more expensive wheelchairs, as Alba mentioned, with the minimum that's provided at the moment. And next slide. And then related to personnel, we already mentioned that there is this new center proposed in concept, but certainly would continue to recommend connections like through this group, for example, and ISWP, and perhaps with the new wheelchair educators package that could help to strengthen university wheelchair curricula and intermediate training of professionals currently delivering wheelchairs. Go on to the next one, please. So we'd like you to, again, take out your pen and paper, and this time, please reflect on suggestions that you have for potential rapid and sustainable wheelchair sector development in the Dominican Republic. And we'll again just take a couple of minutes for this one so that we could perhaps have some time for discussion at the end. We would love to hear your suggestions and perhaps some opportunities for collaboration. We open the floor. I think Rosie's comment was from the previous discussion point, which was what you have achieved in the Dominican Republic is very impressive. I'm impressed with the education for the insurance companies. Thanks, Rosie. And Sarah suggests that more communication within the different stakeholders that are working on the country could support a rapid development, ensure more teamwork and less repetition of efforts. Thanks, Sarah. Maybe again, another stakeholders meeting, perhaps, since the last one was held a couple years ago. And Lee suggests that there's information on the wheelchair skills program and the remote online courses and certification exam. You can find those resources at the website that Lee provides in his chat. Thank you very much for those contributions. Thanks, Dana. Dana suggests that he's been working in less resource settings since 1999 and is encouraged to hear about and see positive changes taking place. Thank you. And Rosie suggests subsidized education and training. I think we could just open it up for general discussion and perhaps, I think the last slide has our contact info. Is that true? Or maybe it does not, but we can share it in the chat. And Rosie suggests, or Sudhakar suggests, continuous professional development and mentoring would enable personnel. Thank you. And certainly would recommend, I'm assuming since you all found this session today that you are already signed up for our distribution list to receive our newsletter and connected with us on social media. But if you're not, please do so. And you're able to find out about mentoring opportunities and the professional development that is offered by ISWP. Rosie suggests localized follow-up maintenance and repair involving capacity building in the local communities and involving the wheelchair users themselves. Corinne suggests that in Russia, every step is funded by the Social Security Fund. The assessment is performed by the local rehab center. The wheelchairs are provided by the local medical and social expertise bureau. So the entire system is centralized. Very interesting. Thank you.
Yes, Mary.
Please, Alba.
Yeah, I would like just to dive in regarding the certification process and why we would like to include the wheelchair service provision within this process. I said that it's mandatory, right, to have the certification, but it's also because the certification system will be within the health system and it will be working with multidisciplinary professionals. And in ADR, which is the NGO that I mentioned that offers most of the rehabilitation services, and also the centers, the public centers, the health public centers. So it means that when people will be in need of a wheelchair, they will encounter a team of a social worker, a medical doctor, and a rehabilitation professional to assess the not only disability, but also in the same moment the wheelchair need, and it will be able to link the, to stay within the health system. And we still have a lot of challenges regarding information system, as you mentioned, because you go to a hospital and then you go to another and no one knows anything about what you said before, but we need to improve that, of course. But at least we are like cutting the steps for people who need a wheelchair. If you go to Conadis to ask for a wheelchair because through the health insurance, and I mean, it will be like a lot of steps. And if the certification process that will begin this year, it will be within your local context that will be closer to you. And also you will do everything in one step, and that will be really great for people with disability, and you will have like the services in the same place, and you can connect with other services there. So that was pretty much the idea. We are already beginning the care process, the care policies that you mentioned in 3 different locations, and there are funds to ensure like the certification process and also assistive technology, and not only wheelchairs. While we are trying to make sure, like with CONADIS, is that it's a system and not only, you know, not to continue with the charity process that we had before. So hopefully we'll get to that. Thank you.
Thank you, Alba. Rosie echoes specific wheelchair provision policy and guidelines. It's also worth bringing to this group's attention that the WHO wheelchair service standards is an activity that ISWP and other organizations on the call have been supporting as well. And hopefully will be out sometime in the next year. I know it's delayed a bit, as well as the new world report. So I think that's coming out within the next couple of weeks. And so perhaps there's some helpful text there that can support some of these changes. We want to thank everyone for participating today, and really want to thank Alba, who I think forgot to mention at the beginning of the call, also sits on our founding board, has a new role in the Dominican Republic, and still stays engaged in the wheelchair work. So kudos to you, Alba, and we appreciate all your support and for presenting today, and the academic training partners and Krithika and organizing team for all of your work and keeping us afloat. So thank you so much to everyone, and have a good rest of your day. Thank you.
Thank you.
Thank you all. Gracias, Alba. Ciao.
Gracias, Alba.
Bye. Gracias.
See you soon. Bye-bye.